Okay, we are excited to have another clinical conversation today with Agents of Change Continuing Ed. Today we have someone that works with us at Agents of Change. We have Bonnie Solis. She's going to talk to us about some of the work that she does in Texas. And this is a really exciting course because this is going to be a three-part series. We know that we cannot cover all the topic in just a 1 hour session. So we are going to really today to set the foundation and then dive deeper into the clinical discussions and some of the ethical pieces and more of the trauma and grief processing in further sessions. So this is a teaser, so you'll have to stay tuned for our other parts. But we are going to be covering resilient roots, strengthening migrant youth through culturally competent care. Bonnie has been working in this area of mental health for some time, so she's going to really have some on the ground insight to share with us. So we are very excited. A little bit about me. I'm not going to share everything, but I am the CEO and founder of Agents of Change. I also am in private practice. I do child and adolescent psychotherapy, working with neurodivergent children and youth. And then because I'm not doing enough things, I'm also getting a doctorate of social work from SUNY Buffalo. And I'm actually studying multicultural supervision. I'm studying cultural humility. So I am very excited because I think this will be a very good primer for some of the work I'm doing in my doctoral program as well. And then this is Bonnie. Bonnie Solis has her MSSW from University of Texas, Rio Grande Valley. How do you say that, Bonnie? Rio Grande Valley?
University of Texas, Rio Grande Valley.
Yes, thank you. And she, of course, like I said, she works for us as the social media and content manager for Agents of Change, which has been, so if you follow us on social, she does some really great content stuff and professional development stuff. She facilitates our professional success too. She helps our community out and she really is giving good content out there. In her full-time job, she is a clinician in Texas and she does mental health assessments and counseling interventions for youth. And she does case management. She has a variety of different things. So she'll talk a little bit more about that. She has psychoeducation sessions. She does group sessions. It's really exciting stuff. She was previously an advocate supervisor at CASA. We could probably get into that a little bit too. I'm sure all of these experiences build upon each other. She had internships with Behavioral Health Solutions in the Children's Center. She's worked with substance abuse, foster care, support group, everything, right? Like when we first get started, we kind of have our hands in everything. She also works for the NASW Texas State Conference. She's been doing that for a couple years, and she was Social Work Student of the Year in 2019 from the NASW Lower Rio Grande Valley, which is great. And Bonnie, will you just tell us your current role now and what you do in your full-time job?
Yeah, so like Megan mentioned, I am their current social media and content manager. So of course, I like creating content for exam prep or CEU training, just educating aspiring social workers of maybe changes for the exam that we know have been happening, um, study tips, and of course, all the important information that Megan has shared on the program, just making sure that everyone knows what is on Agents of Change in order to prepare for these things, or of course, fulfill our roles as social workers in the profession once we reach that goal. And in my full-time job, I am a clinician. Like Megan mentioned, I do work with youth, specifically migrant youth, doing individual sessions, doing family sessions, and group work. But my background, considering the area that I'm in, I have worked with migrants throughout my career, whether it be in foster care, substance use. So I do would like to share that information with you all so that we can become culturally competent in the work that we do.
Awesome, thank you. And we'll get into a little bit more about Bonnie's specific work, and she can tell you geographically why she's been involved with this work for so long. She's in a unique place where this is very at the forefront of what she does. A little bit of housekeeping. We have our learning objectives for today. We have 3 learning objectives. Participants will be able to understand and apply cultural competence in support of migrant youth. We're going to talk about cultural competence as well as cultural humility and what the difference is, and how as practitioners, how as clinicians, you can really come from a place of cultural humility when working with migrant youth of diverse backgrounds. Participants will be able to develop strategies for normalizing mental health services among migrant youth. Bonnie will talk to us about some of the barriers that exist, or some of the challenges she sees in getting youth to access these services. And then participants will also be able to explore and share acculturation identity preservation strategies in migrant youth. Bonnie has real life examples of kind of how this comes about with the work that she does, maybe in groups. She has different stories to share as well. So that's some of our objectives today. Remember, today's just kind of the foundation. We'll get more into the clinical topics in our further sessions, parts 2 and part 3. Why is this topic important? I'm so happy that Bonnie agreed to talk with us today, because I think this is an area that a lot of people probably don't know much about unless you are really in that work, right? So here, I think geographic location makes a big difference in the amount of cases you might see with migrant youth or working with migrant youth. So why it's important? Because this is an ongoing issue. Bonnie and I were talking just before this. It spans many different domains, right? It's a political issue. It's a social issue. It's an economic issue. There's tons of different things we could talk about there. So, and it's complex. It's very complex. So she'll talk about some of those complexities a little bit more. Addressing mental health stigma and promoting well-being. How can we break down and advocate for mental health care for the specific population? And then we want to support identity formation and acculturation with our migrant youth. So she'll talk a little bit about what that process will look like. It's not linear. It's not the same for every client that she works with, but we'll talk a little bit about that as well. Before we jump into kind of the more conversational piece of this, Bonnie and I just wanted to cover a few terms that might be important to kind of set the stage for our conversation today. So we're going to define some of those key terms. The first one is cultural competence. This is in our code of ethics, right? We need to be culturally competent. And what is cultural competency? It's working with clients of diverse backgrounds, diverse cultural backgrounds. In this case, we're going to be talking about migrant youth. It's learning information about their strengths, their values, their norms, so that we can affirm them and their experiences. We want to create an inclusive and supportive environment for their growth and development. So Code of Ethics says we need to be culturally competent, which means we are seeking out information so that we can learn about different cultures. It's not possible for us to be experts in different cultures or backgrounds that are not our own, right? So we often hear cultural competency, cultural competency, cultural competency. This is actually the interesting piece of what I'm studying for my doctorate program is cultural humility. So a lot of people have started to frame the cultural competency piece with new language, cultural humility. What's the difference? They're very similar, but cultural humility is kind of a different way of thinking about this. It's basically saying we're not the experts in diverse cultural backgrounds, right? We need to be humble and curious, right? Only the individual is the only person that's an expert on their own experience. So cultural humility is saying that there's strengths that every person has, there's resilience within all of our clients, and they all have unique experiences and perspectives. And we're not here to become experts on that. We're here to really learn from them and provide support. So just kind of a mind shift with the 2 different terms, but cultural humility is basically saying I can't ever possibly learn everything. I can't be competent or not competent, right? I can always be curious. I can always acquire more knowledge, and I should be acquiring more knowledge because I'm not the expert. So I like to frame things from the cultural humility, because it's just saying, you know what? I see this too. The more I learn, the more I know I don't know. So just being open, being curious, and with cultural humility, it's not that I just check the box, I'm competent now. It's that I'm always ongoing. I'm going to be self-aware. I'm going to be mindful of microaggressions. I'm going to be mindful of implicit bias. So that will be a whole nother discussion once I get some of my training materials off the ground for cultural humility training. So Bonnie's going to talk to us a little bit about what assimilation is and acculturation, because it's going to be kind of important for us to discuss as we get into our discussion in just a few moments here. So go ahead, Bonnie.
Yes, so assimilation definitely refers to the complete adaptation of, the change or the new area of where you're in. That may be language, culture, traditions, even down to like clothing, social media, things that we see. It's definitely a change if you're moving to a different area. And of course, that's something that we can be impacted ourselves if you move from one state to another, from one school to another, maybe just down the street, we see those changes. But assimilation is understanding the complete change that is going on to this new area that you're in. So, from an affirmation lens, it's important to emphasize that assimilation should not be the only or expected outcome from a migrant youth in this where we're focused on. But instead, affirming the approach is to recognize the value of maintaining one's culture, so their roots, their background, where they're coming from, while also participating and benefiting from the area that they're moving to or where they're currently at. Assimilation may not be the goal, but of course, we would want to foster a balance that respects their cultural diversity. So, of course, this is something in which they're understanding the new changes and also keeping in mind their own values of what they previously practiced or did. Acculturation is a little bit different, in which it's the process that migrant youth adapt to navigate the changes in culture, although maintaining the aspects of their own culture identity. As I mentioned, language, culture, traditions. Affirming perspective, acculturation recognizes that youth process the values of their culture, resources to enhance their ability to thrive in their new environment, which of course is something that us as social workers want to focus on, and making sure that they are reaching their goals. They come here with something in mind to change their lives for the better. So of course, we want to make sure that they have an understanding of the new environment that they're going to be in, such as laws and rules, routines and schedules that they may have in school, in their new home, while also having their own culture and language and comfort of that in their own home. So, of course, celebrating resilience and adaptivity of these youth is really important in aspects of their heritage, while also living their lives and embracing the new opportunities and experiences that they're going to have.
Yeah. So that's, like I said, these are just kind of some key terms. Throughout this series, we're going to continue to introduce different terms, but it's really important that you understand these because it's going to be very common to the experiences that Bonnie's going to discuss. So now we're going to kind of jump into getting some of the expertise that Bonnie has to offer. So Bonnie, tell us a little bit about how you got into this work. Tell us a little bit. She's in Texas, so she is in a unique geographic location for this. And what would we consider a migrant youth? Like, just kind of what's the population that you work with? What does that mean?
Yeah, so just to start off, I do want to mention I am a third generation, meaning that my grandparents crossed over to come over here to the United States. So I am bilingual. I do know Spanish, speak English as well. But this definitely broadens the work that I'm in, considering that I'm in Texas. Seeing this in many agencies, many different environments, whether I'm going to the store or I'm at work, I see migrant youth or migrant individuals and speaking different languages in these areas that I'm going to. But specifically working with migrant youth and what I do um, is seeing them when they come in, right? So I'm kind of maybe the second face that they see coming in here and trying to give them an understanding of um, that they're currently in a safe place, that they're in a safe environment, of course, when we're in a session, and kind of getting an idea of where they're coming from and what their goals are, because that is very important. And of course, in doing so and asking them open-ended questions to understand them, their culture, their language, gives you the ability to be culturally competent. Um, like I mentioned, just because I am third generation doesn't mean I can assume that they follow my religion, my traditions, my culture. And of course, working with migrant youth isn't necessarily Latinos or Latinas, right? We have to keep in mind that migrants can come from any other area. So, of course, I have also worked with migrants from other areas as well. So, you also have to ask yourself and be um, aware of the language that they're speaking, right? So, not initially assume that they speak English, depending on the agency that you are working in. So, always keeping that open ended to ask them, like, okay, do you understand English? And is that something that you're comfortable with? Even though they might understand the language, is that something that they're completely comfortable with? Because we might be asking very difficult questions, we might be utilizing terms that they don't know or understand in their own language.
Mhm.
So if we're saying that in English, that's something very difficult for them to understand. So first and foremost is knowing the language that they speak.
I have a follow-up question to that. Um, do you get some clients that maybe are from different parts of Central America that have particular dialects that aren't even captured by maybe someone that you have in the agency? Because I know when I've traveled in different things, it's not just everyone speaks the same type of Spanish. So if you do get a client that comes in with a very specific, maybe even an indigenous dialect, how do you approach that?
Yeah, so that definitely happens. We do have various dialects. We do see some common ones, but of course, we do have the open-ended question of what their language is, what they're comfortable with. Given that these are youth, they're children, they're nervous, they don't know you.
Mhm.
Sometimes they just say yes
I
to
was figuring
everything.
that might be the case. Just they're scared probably too.
Yeah, so I try to create a safe environment for them and say, hey, it's not a big deal. If you don't understand, or you're not comfortable with Spanish, or I see that I'm asking these questions because they say yes to Spanish, and you kind of see their facial expressions or their pauses in their responses, and you see that it's more of a language barrier, you let them know that, hey, we have interpreters that we can connect so that you can completely understand these questions.
Mhm.
I don't want you saying yes or no to something that could be bad, and I don't understand you and I can't help you because I can focus on certain things that we need to focus on if we're able to answer these questions. And of course, something that they're comfortable with, because if they don't want to provide a response, then that's okay too.
Right.
But you don't want it to be a language barrier of them saying, suicide is a big one, term wise, of not understanding what suicide is. So of course that's something important to where, you ask them about these questions and then they're kind of like, yes, yes. And they're just like, and so you see that they don't understand. So of course you want to make sure you get an interpreter for them or explain these words properly in their language as well. So maybe breaking it down if that's something that's needed.
Yeah, that's really helpful. And in westernized culture, we are very blunt about the word suicide, where in other cultures they might not use that word or it might be taboo. So I could definitely see them see different people not understanding what that is or never hearing that term before or it being referred to as something different in their language. So that's a really good point. I have a follow-up question for you. How do these clients, first, what age do you see with youth, right? What's the youngest you might see in your agency, and then I'm assuming up to adulthood, but how would they get entered into care with your agency?
Yes, so I currently work with ages 10 to 17, females and youth. A way that they enter our program is in a variety of ways, but the main one is in which, they come into the United States. They are taken by Border Patrol, whether they're most of the time it's something that they know and are prepared for. So they look for Border Patrol when they come. And then from there, they're processed. But of course, there is um, a law in which Border Patrol cannot hold them for too long. Of course, that's not giving them a proper environment or a safe place for them. It's not giving them education, which is kind of like a main view for the United States is giving them proper education and a safe environment. So in that, we have certain programs and shelters in order to care for these kids until we can find someone who can take care of them. So it also comes hand in hand with working with foster youth,
Mm.
in which they're in a safe place until we can find this family member or this other individual um, that they are interested in staying with, and we guarantee that this person is a safe person for them.
Okay, great. Thank you for that clarification. So, we've talked about cultural competency, we've talked about cultural humility. How does so when a youth's coming into the program, we've talked a lot about being barriers or there being barriers or stigma to mental health care, right? What are some of the barriers you face, maybe on an individual level or even on a bigger scale? Maybe there's policies that are setting up barriers, but what are some common pitfalls you see when you're trying to provide care for these clients?
I think one to one with these clients is them um, seeing it as mental health is something for someone that's crazy, someone
Mm.
that, really needs the help because they're not able to do their daily tasks, or they're not able to necessarily socialize with people because you see that they're crazy, is something that is explained. But I try to relay the information to them as what they're currently going through is a very big change, and what they're feeling is okay. And there's a lot of emotions, there's a lot of worry right now, and that's okay. But we need to learn how to process these emotions, and we need to learn what these emotions are. And in order to process and learn what these emotions are, we need to do certain exercises. And I always explain to them, of course, they're youth, they're children. So I tell them just as important it is to go and play and run every day, of course. It's also important that we do mental health exercises for ourselves in order to be focused, in order for us to feel some clarity, in order for us to sleep better, eat better. Of course, it goes all the way around, but in order to explain this to them, I explain it to them as exercise. And sometimes there's barriers in which they don't understand. Hey, I practiced deep breathing and it didn't help. They want to see like an automatic change. But I also explain it to them for the children who are really struggling with their emotions, with their anger, and they want to see an immediate solution or immediate fix. I also explain to them as, depending on how I see them being able to understand it. But with one specific youth, I was able to explain it as, if you have a goal to gain muscle or to lose weight, is that something that we see right away? Of course, we want to see it right away, but you're not going to see it. You go work out and you go weigh yourself, and you don't see the result that you want right after your workout or right after you eat a meal, depending on what your goal is. So, of course, it would be the same with mental health in keeping these practices or exercises consistent.
That's really helpful. And a quick clarifying question. Are these youth, is it an expectation that they do engage in the program, so they have to be there? Do you get some that are like, I don't want to be here, I'm just coming here because I have to be because I'm part of a program?
Yeah, it just depends. Some of them are trying to get a grasp of, what's going on, the new changes. We do try to open it up to them in which we say, give it a shot and try it out, especially when it's mental health related. But of course, you want to stay culturally competent and practice your social work ethics in which you're not going to push a client to do something that they would be uncomfortable with. So, of course, kind of gearing yourself towards the age, the language, and where they're at. Sometimes it might be that they need their space and they don't want to participate
Yeah.
at that time, and that's okay. We need to understand that coping skills is different for everyone.
Mm.
So they might need their quiet time right now. They can't practice deep breathing or playing outside because they just need some silence and some quiet time. And of course, in participating in other things, when you're a practicing social worker or aspiring practicing social worker, you want to make sure that you provide a safe place for these people um, in any environment that you're working with and not pushing your client to doing something that they're not comfortable with.
Yeah, especially we'll get into this in the next parts, but due to the trauma that they have probably experienced or ongoing are experiencing due to the changes, we're going to get into that into the next one and grieving, right? They're grieving probably many losses, many small losses, many big losses. So just making sure that clinicians are aware that this is going to be an ongoing cycle for these clients and just really meeting them where they're at. I love that you talked about play because obviously I do a lot with play therapy. With the younger kids, do you find that maybe using expressive arts or maybe something that they don't have to talk about so much, so getting their bodies moving, art, that type of stuff. Do you see that that's a really good way to connect with the youth? Because play is just universal, right? Play is universal.
Yes. Yeah, definitely. We do a lot of like different games with them, maybe Jenga, maybe puzzles, coloring, and of course, according to the age, like I mentioned, I previously worked with foster youth. Um, Getting an understanding of the environment and the people that they're comfortable with is important. And if that's drawing a home and drawing the people that they want in their home, that's also doing social work tasking where you see like, okay, this is their inner circle, their outer
Mhm.
circle, who they're comfortable with. So definitely doing some play therapy is very good and a different insight to where they feel like they may not feel obligated that they
Mhm.
are participating, but they're doing an activity that they enjoy and giving you information at the same time. And you're also building rapport with them during
Absolutely. I mean,
training
I
as
use
well.
tons of games and play, and sometimes parents say, so you just play? And I said, it's really a good observation and assessment piece because even if you're just doing a back and forth turn taking, you get to observe so much. You can observe body language, you can observe reactions to disappointment, you can observe flexibility, you can just observe so many things. So I think it's such a great starting point so that you're not just you're coming in, we're just going to sit in this chair and talk, right? Not many kids are going to want to do that or be able to do that, and a lot of kids need to move their body, right? So we can do big body movements, all those different types of things. How much follow up to that, how much of your role is providing psychoeducation, just of this is the experience that you are going through, this is common to the experience? Because I don't know. I don't work in this space. You can tell me, but do some of the youth feel shame or embarrassment or I'm all alone in this? So do you have to provide some psychoeducation to say, this is a very common reaction to what you've been going through?
Yes, I would say about 50%, maybe 70% if we're also considering like our group sessions that we're doing, just because we do want to focus on um, giving these kids confidence. I
Mm,
think a lot of it is helping them with some confidence and understanding what they're going through, and also understanding that everyone's going to process these things differently. So, a big explanation that I give, even if they're coming in with a sibling or they're coming in with another family member, and they're both in the program with us, or several family members with us, whether they're twins or not twins. I always explain to them, you all are two very different individuals. You
Mhm.
may be raised by the same people, you may come from the same home or not, right? But um, you have totally different experiences, especially if they're different ages. But even if they are the same age, they are going to hear, see, their senses are very different to what they're
Mhm.
taking in during their journey, during the process, and of course, during their time here with us. So I always explain to them that they're going to process things differently because of everything that they take in is going to be different, even if they're in the same room. And I tell them, me and you currently are in the same room, sharing the same conversation, sharing the same topic. But I see something different from you because I'm facing this way and you're facing that way, right? And of course, we're in different roles. So we process these things very differently. So definitely just explaining that to them as well, so that they can understand that their emotions are valid, whether
Mhm.
that's different from someone else going through the exact same thing as they are, it's still different for them. And it's okay what they feel. And it's okay to practice different things, different coping skills. Something might work for them, might not work for the other one. I've had certain youth tell me, um, hey, one of your kids was telling me that you practice deep breathing with them. Do you mind teaching me that? And they weren't assigned to me, but I did have to follow up with them, and they were very curious as to what that
Mhm.
exercise was. So that's okay if that's something that they want to learn.
Yeah.
And sometimes they say, like, oh, it didn't work for them, but I'm very curious.
Hmm.
So of course, understanding and explaining to them, you might like dancing and drawing and singing. Someone else likes to play outside, and run. So same goes for coping skills.
Yeah. So it sounds like you use a very individual based approach, right? It's not that, oh, we're all going to do this thing together and this will work for you, right? I love that you use that different senses. I do a lot of sensory work and being in touch with your senses and that perspective taking, right? Like I've even had kids I pull up like a piece of art, right? Or a picture and I say, "What do you see?" And then they'll say it and I'll say, "Well, I see this." And I'll just say something completely different. They're like, "What? No way." And I said, "Yeah, it's amazing that people can see literally the same image, but process it in a very different way." So I love that you said that you'll say, even I'm sitting in a different angle than you in the room, right? Or because you're different heights, you will be able, and I think that's a really good way to bring it down to their level because it can feel really confusing. So I love that you do that. How often are you engaging with people outside of your agency? Do you work with teachers? Do you work with family members, um, medical staff? Because I can imagine that this is definitely a wraparound holistic approach that you'd need to provide.
Yeah, definitely. We do work with various different individuals and, of course, different like departments. We want to keep the child involved. And something that I always keep the child open to is, what is said here stays here.
Mhm.
But if you're needing help with something, your head doesn't feel really well, or you feel really ill, of course, we're going to seek those services that you need. And if you're feeling uncomfortable in your educational class, or if you feel like the information's not sticking, or for some, that class or that level is too easy,
Yeah.
let's speak to these individuals so that you are in a comfortable environment and you are getting the services that you need. So definitely keeping that open as well, and letting the clients know that they understand that you're only sharing the information that is needed, to share with those other individuals to get them the services that they need.
Right. So really important about going over confidentiality. And that could be a completely new topic, right? Like that we have to uphold confidentiality and we will break confidentiality if danger to self, danger to others, but really providing that information upfront and just reminding them so that they'll feel open to share with you and you'll connect to the different providers that you need. Um, how long do you typically get to work with your clients? Is it short term? Is it long term? Does it depend?
Some of them can be very short term, from like 5 days to
Okay.
a little bit longer. A norm could be a month,
Okay.
something a little bit longer, maybe 3 months. Of course, if there's any roads in the like bumps in the road, um, or maybe the child needs medical care,
Yeah.
and it might not be safe for them to travel. So of course, we do want to take care of those things and services that they might need in order for them to safely continue their journey.
And so are you sometimes the a stopping point in their journey and maybe they're going to different places within the state or even maybe going different places in the United States?
For the most part, not that I see, but they will continue services while they're with us, or we, of course, guarantee that, just like anyone else, a safe discharge,
Okay.
that they might have that appointment to where they're going, if that's an option that's recommended.
Okay. So discharge planning, making sure that they understand, why they have to be discharged. It might just be because you're moving to somewhere else or you're going to get care under someone else. How do you frame that, being that they may have experienced so many different transitions already that, we're discharging and you might have formed some really strong bonds and relationships with those clients. So how do you prepare them for discharge? Because and sometimes you might not be able to prepare in the way that you want, right? Given the nature, it might just be like you said, very short term.
Yeah. A lot of it is safety planning.
Mhm.
So kind of getting them or giving them an understanding of the new changes that they're going to face, where they're going, preparing them for the new area that they're going to. And that could be in different ways, whether it's a family session, and most of the time that's something that we do, of course. Whether it's going through Google Maps and showing them the area so that they can visually see these areas, or of course through FaceTime in a family session.
That's great.
Other things are also going through like laws such as the importance of attending school till you're 18 and what a normal schedule would look like, and discussing that routine with the family members, as well as giving them access to like national hotline numbers, giving them access to services in their area. So we do give them information to services that are near them,
Mhm.
or like I like to explain is nearest to you. Not necessarily that you have to go to that person
Right.
if you're not comfortable with them, but this is the one closest to your home, and that's something that you can try. And I always tell them, I want you to know that you're not alone. Yes, you're leaving from here, but you're not alone. You have this family member. You're going to build relationships in your school. You're going to build relationships in people in your community. But you also have this information that we're providing you with, of resources in your area or of hotlines if you're not comfortable seeking these services. And aside from that, also giving them an understanding that their family members might want to help them, but might not know how to help them.
Right.
So a lot of it is understanding that like they can have these discussions with their family members, and utilize these resources as their help and their support system, for their family members or for themselves.
So a lot of self-advocacy, right? Like you can build these skills to advocate for yourself. In those family sessions, do you, if maybe the family member is not aware of the services, do you then also bring the family members into the conversation to say, this is what's available? Um, Child might be interested in seeking services in this area. Do you do that, like bridging the gap and kind of advocating within the family sessions?
Yes, we actually discuss a safety plan with them and send it over to them. Of course, making sure that it is in their language and something that they understand. A lot of things that we have to keep in mind working with any client, or of course, maybe something generational, keeping in mind, are these individuals able to understand the language? Are they able to read? Are they able to write? So always keeping that in mind. And of course, other, maybe a disability that they may have, making sure that you're keeping that in mind, that the client understands, if you're providing them with a paper. Um, so definitely going over that information in a way that these clients are going to understand.
That brought up a really important thing, just from a cultural humility standpoint. I have worked with clients where I have made the mistake assuming that they are literate or providing a paper and then it never comes back to me and I'm like, well, why was that? It's because they didn't have the literacy level to read it or it wasn't in their home language. So from a cultural humility standpoint, how do you as a clinician assess, like, because we don't want to offend, right? But we do want to ask. So how do we provide the support that they need? Maybe they have a visual impairment or maybe they have a learning disability. How do we get that information without trying, but also being supportive and not assuming?
Mhm. I think it's definitely keeping it as an open-ended question, and sharing with them that you'd like to share more information with them, and how they would like to receive that information or how they would better understand that information. Personally, for me, I guess I'd like to share something a little bit personal. Growing up, I was informed that I was diagnosed with dyslexia, which is a learning disability, and you might need a little bit more assistance, in which I was like separated from groups at certain times of like testing or something that we had to like focus on. I was separated. But at that point, you understand that it's giving individuals, you're empowering individuals to understand the information.
Yeah. Yeah, I think giving like open-ended questions instead of just saying, here is the paper, right? Or taking those kind of observational pieces, right? Like, do they seem like they understand? Are they processing the information? If you have someone that like completely is tuned out, right? Like maybe the information's not landing the way that we want it to, or um asking those questions. What's the best way for you to receive information, right? Would you like it verbally? Even I've asked, would you like information via text or email? They might not have access to text or email, right? So maybe a physical piece of paper is best, or a phone call, right? We forget that you can make just a regular phone call, but just asking preferences and not assuming that whatever society's preferences at the time, right, is what they prefer. So do you also find that there's different preferences for different modes of technology and that type of thing as well?
Yes, definitely. And also helping the children understand that, you know, their parents or their family members may not understand how to do it as quickly as they can. Because they're kind of like, oh, like, how have you not done this? You know, or like sending a message or sending a picture, and letting them understand that it may not be, you know, as simple for them. Or also letting them know there's always updates to apps. So even though you've learned, you know, there's changes that are going on and we might not be able to get it as quickly because there's always updates. So that's definitely something difficult that I think anyone can face, is that there's always updates. So even though you're familiar with it, you may not be able to find it because it's not the same.
Yeah.
Um, and aside from that, I did want to add, just as we need to paraphrase or summarize things for clients so that we make sure that we're understanding correctly, maybe you can allow your client to paraphrase or summarize the information, so that you know that they're understanding as well.
That's a really good check for understanding because, like you said, a lot of times kids, especially if they're not comfortable or they want to please, right? So, yes, yes, yes. So I like that you said checking kind of for understanding. Do they actually know what we're saying? Do they understand those types of things? And we have to consider developmentally appropriate, right? What developmental level are they at? Is this appropriate for their age? And that does not necessarily mean chronological age, right? They might be delayed in certain areas, or they might have never been exposed to certain things. So we can't just assume, always, 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 no assumptions. Just ask those questions and come from a place of curiosity.
Yes.
So I wanted to end with one last question before we wrap up part one, and we're going to talk about ethics. How does it work? Because I know that some people might feel a little bit in the dark about this or unsure. If they are migrant youth, if they are undocumented, is there any ethical considerations that you need to consider, confidentiality, privacy, to protect their status and to protect them as you're working with them as well?
Yeah. So definitely, when going over to confidentiality, letting them know exactly where this information is being stored.
Okay.
So I think that goes for any client, whether you're in private practice, which I think is very important to explain, or other practices, right? Just like a doctor's office or a job that you're applying for, I'm providing personal information. Where is this being stored?
Right.
And how would I like this information to be stored? And taking that into consideration with your clients. But keeping that door open to being completely honest and letting them know that, hey, this is the information that I'm gathering, and this might be, information of where it might be saved, and these are the people who have access to it. Um, with that being said, you have every right to share information or withhold information if you're not comfortable. And continuously telling them that, because as youth, they're children and they might not understand, or it might be too much information for them that day. So, of
Yeah.
course, you want to reiterate these things to them throughout the sessions.
And is that a fear sometimes that I don't maybe feel comfortable sharing because you might use this information against me? I have in Washington, D.C., we obviously are not near a geographic border, but nation's capital, we do see a lot of migrant youth and some families not wanting to share information until they felt comfortable because they were worried, right? Will I be deported? Will this information be used against me? Is this going to be actually more harmful for me? So do you get some of that fear when clients come?
So I've seen this in various populations, in work and outside of work. Specifically with the youth, I actually see it as them feeling more comfortable to overshare. This is where you kind of see their
Ah,
eyes light up and they're like, let me
ooh.
tell you what I've been through.
Yeah.
Um, so most of the time that certain things that I've seen, other very minimal amount of children do become scared and they say that they don't want to share. Of course, a lot of these kids might be in shock, so you have to take that into consideration of what they're really wanting to share. Um, we do come into issues or barriers in which these kids might not have family members necessarily, for the reason of fear,
Yeah,
in which these people don't want to come forward because, of course, they would have to share their personal
right,
information of where they live in order for us to understand that they're going to go to a safe environment for that specific reason. But they feel like in providing their personal information, they'd be on the radar of deportation.
yeah. So something to consider too, which I think a lot of providers would probably feel a little bit uncomfortable when that comes up, right? Like what do I do? So I definitely suggest seeing what your agency policy is. Every agency is going to be different. And being very mindful how you are documenting, where you're documenting, case notes, all of that type of stuff as well. But of course, we need to best interest of the client at all times, dignity and worth of the person. But I think that some people might be fearful, some clinicians might be fearful, am I doing the right thing? Because we've talked about this spans all areas, political, right, social, economic, and depending on your political environment, it can feel probably more or less tense based on what's going on as well.
Yeah, and I think it's important to understand different forms of documentation, in being focused on what your interventions are and what is it that you utilize, and them participating or not participating that day for their emotions that they felt, and not necessarily having to share every single
Right.
detail if it is not necessary.
Yep.
Of course, if it is a safety concern of
Absolutely.
self-harm, that's definitely something different. But maybe keeping in mind that just documenting what your interventions are and how they participated that day or in that session, may be all that needs to be shared.
Right.
Um, and if you built rapport because they shared a personal story, that's a way to document it as well. During the session, the child shared a personal story in which they expressed these emotions, and we utilize these interventions
Right.
or these coping skills in order to process those emotions. So, right now, in sharing that, you're able to see, or whoever's reading the documentation, that this child shared something personal, that we
Yes.
utilize these interventions or these coping skills, without sharing the personal information of that story.
Yeah. And remember, I always say this, our notes could be subpoenaed at any time. So you got to be very mindful of what you're putting or not putting in your notes. So that's just a good reminder too, to make sure you have good note-taking abilities and you're getting support if you don't know what to share. Speak with the supervisor, right? Does this meet what I need it to meet for liability purposes and whatnot? Is it capturing what I need it to? Because it could be subpoenaed at any time. So just always be mindful. We want to bring up the ethics piece always because we want to keep our license and we want to make sure not only do we keep our license, that's one part, but we want to make sure our clients are safe always and the information that they share is safe and protected and it's not going to cause more harm.
Yes, and definitely documenting the steps that you took after the session if that's
Yes.
something that's needed, and communicating with such and such department or such and such person of specific information that was needed for services that they might need as well.
Right. Contacts, like if you talk to a family member, you don't have to put the specifics, but communicated with parent via phone call, right? Those are just the things that always are important. And if you did not document it, it did not happen. So that's always what I say is you document is important. Well, Bonnie, that was a great, I think, first little preview into this series. In the next couple, we're going to talk about more of the clinical implications of working with migrant youth, viewing this as ongoing loss and viewing it from a grief perspective, because it's just a very ongoing process. So we'll dive a little bit deeper into that into part two. And what are some particular interventions we can use when we are working with migrant youth? But I just wanted to say thank you for sharing your expertise. I look forward to part two. If anyone's interested, here are some key resources that we use to kind of pull this information. And it talks about cultural competency. It talks about migrant youth, immigrant youth, refugees. We're going to cover more of this in further sessions. So check this out if you're interested. And then Bonnie, I wanted to thank you for taking the time and we look forward to having you again for parts two and part three.
Thank you so much for letting me share all this information with you. As we mentioned, we will have other parts, so definitely join us for more information.
Yes, thank you so much. I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.